Stellenbosch University has launched the Africa Center for Therapeutic Innovation. This pioneering initiative marks a strategic shift from reliance on imported medical solutions to the homegrown development of novel drugs and therapeutics. Established with a clear, urgent mission, ACTI is dedicated to building a robust pipeline of drug discovery projects specifically targeted at diseases disproportionately affecting African populations. Co-director at the African Center for Therapeutic Innovation, Professor Lyn-Marie Birkhotz, joins me now for more. A very good morning to you, Prof. Thanks very much for your time. I guess a question many people would ask is why it has taken so long to get to this point.
Yes, well, thank you firstly for the invitation. And it is actually quite an interesting environment that we find ourselves in. What Stellenbosch University is now doing is that we are consolidating disciplines and expertise from people at the university to work towards drug discovery. And it's not the first time that it's happening in Africa. There are other institutions that are also working towards this point, but what Stellenbosch is contributing is something unique. It's something different, and it's something that complements some current activities on the continent, but it is something that is critically important and needed. So the realization is that we have to come up with the therapeutical agents on the continent for the challenges that we are facing. I guess the question is, why did it take so long? Because we've been relying on interventions from external people to save lives in Africa. We've got a very large disease burden, so we had to solve the issue at hand as a critical issue, and therefore the development and the discovery is sort of falling on the buy side because we have to save lives. But we've come to that realization that we cannot rely on those interventions coming from external sources only.
But in very real, practical and layperson's terms, what exactly is this center going to do? What sort of problems is it going to solve?
Yes, like I said, quite a unique center. The university has these people that are experts in mechanistic understanding. So what that really means in lay terms is if we take, and we want to deliver a drug, a therapeutical intervention that we can provide to humans. We start 15 years back with a chemical compound. So there's chemists that are involved in designing these chemical compounds. And then it takes us a very, very long time to get that compound into humans. And it's really important to spend our time on that because we cannot deliver toxic compounds to humans, right? In that process, we need to understand how that chemical compound works. How does it, for instance, kill an infectious organism like a malaria parasite or a TB bacteria? Because if we don't understand how that works, when it then fails, we don't know why. Or when resistance develops, we don't know how to fix that. So we can't spend all of that time and money on a compound trying to get it into a human, into a form that is a pill or injection, without understanding how it works. And it's that mechanistic understanding of a chemical compound and how we can then tweak that and twist that and formulate it better so that it becomes a pill. And that is what Stellenbosch University is going to contribute and what this new center, ACTI, is going to be working on.
And in terms of funding and costs, how easy or difficult is it going to be for the center to actually do what it's intended to do?
Absolutely, that's always a critical thing and drug discovery is a very expensive process, not just because of time, but also because of this expertise that is contributed. We've been very, very fortunate, though, that we've been very strongly supported by funders like the Gates Foundation and also LifeArc, which is a UK-based funding agency. So in that context, they are funding us currently on 2 specific projects, one working on malaria and the other on TB. And this is part of a larger strategy on the continent where we are part of a network called the Grand Challenges Africa Drug Discovery Accelerator. So there's a bit of a intention for funding these kind of strategies in Africa to really allow us to develop these tools on the continent. So the situation is looking a little bit more rosy-colored, but it's still under constraint. So we do need input now from local governments, not just South African governments, but African governments to really support this local development as well.
Is there both appetite and money available, especially from South Africa?
Definitely. Again, in terms of appetite, we've been well supported by the South African government, both the Department of Science, Technology and Innovation, and also the MRC. So definitely, we are in a fortunate situation in South Africa. That's not necessarily true for our neighboring countries or across the continent, and that's part of our job. Is also to communicate and say, why is this important? If we're putting our hands up saying we want to develop interventions for African populations, for African challenges, then we need to convince our local funders that that's also important. And yes, there's not enough money in Africa to be able to support this solely, but we can then partner. But it has to be a dual partnership where we can put our hand up and say, we are doing this, please now come on board and help us.
Any specific universities or centers that you hope to or intend to collaborate with?
Yes, so like I said, this is not something you can do on your own. We are unique in contributing a very specific, making a specific contribution. We are currently already working with a number of institutions across Africa. In South Africa in particular, we're working with the H3D, which is a center at the University of Cape Town, strongly focused on the chemistry component. So we're that perfect partnership because we now take in the next level from the chemists. But then across Africa, this network that we have collaborators starting from Ghana to Mali to Zimbabwe to Kenya to Cameroon. So it's a really nice network to now tap into, and everybody contributes their expertise to this area.
Any sort of lessons you've learned from, say, COVID-19 about how best to do these collaborations, and of course, with that, the cost factor?
Yes, absolutely. I think COVID was such an emergency, and we had to respond to that emergency very quickly. As a result of that, unfortunately, a lot of these diseases in Africa has actually was negatively impacted because a lot of our discoveries was halted because we had to focus on COVID. So part of the realization is that we have to now switch gears as well, and they're really focused on these diseases that we've been struggling against for a long time. Can we do it as quickly as some of the innovations that have happened in COVID? We're definitely learning from that. It's not the same situation though. A vaccine is a different entity to a drug, a therapeutical. But we definitely need to apply some of those, and that kind of emergency that was switched for COVID, that's the kind of drive that we have to apply to interventions for these other diseases as well.
Just remind us, Prof, which are some of our priority diseases at the moment that the center hopes to sort of perhaps zoom in or focus on?
Absolutely. So at the moment, the center is really strongly focusing on malaria because of a historical perspective and the expertise that we have, but we're also working on tuberculosis and then also on other microorganisms. So these organisms that are really becoming resistant to anything that we could throw at it, antibiotics that doesn't work anymore. And that's a massive concern. So these antimicrobial resistant organisms, these infections that you pick up in hospitals, for instance, and there's no therapeutic that can be used for those patients. But then also, so these are these infectious organisms that cause disease, but then there's also these lifestyle diseases, right? So we are focusing on diabetes, we are focusing on neurodegenerative diseases like Alzheimer's. So quite a spread, but it's because the expertise, the technologies that we use to address these are quite similar, and there's quite a lot of overlap between them.
Professor Lyn-Marie Birkhotz, let me thank you very much for your time. Co-director at the Africa Center for Therapeutic Innovation.